Hi there, I'm Sharon Morgan from TameMyPain.com and I'm a psychologist specialising in the treatment of chronic pain. This is a short video about drugs for chronic pain. Many of my patients take medications to relieve their pain, and most of them are really worried about side effects, becoming addicted, and are concerned about their medication not working very well for them. Now, we've all used drugs or medications to eliminate pain at some time in our lives. Medications can be very effective, and as the old adage says, if pain persists, please see a doctor. In fact, we already know that medications can be extremely effective for acute or short-term pain. It helps you get through the phase when your body is recovering from physical injury. In this phase, drugs reduce pain while your body naturally heals itself. Ideally, once your body has recovered, you can stop taking pain medications and return to normal everyday life. However, many chronic pain sufferers experience long-term chronic pain and have tried different forms of medications. These are often not very helpful in the long term. Now, there are many reasons why medications are less helpful for people with chronic pain, but before we talk about that, let's go over some of the basics. Put simply, there are two types of pain-killing drugs on the market. Non-opioids are the drugs we use for mild to moderate pain, for example, aspirin and paracetamol. Drugs like aspirin block particular enzymes in the body. Now, some common side effects include stomach irritation, allergic reactions, tinnitus, kidney damage, and reduced blood clotting ability. Drugs like paracetamol work in the brain to prevent the release of substances that increase pain and temperature. When taken at recommended doses, most people experience minimal side effects from paracetamol, but some people may experience nausea, stomach pains, and allergies. It's important to remember that paracetamol can be extremely dangerous to kidney function or result in overdose when taken outside of recommended doses, so please take always as directed. These medications are good at managing less severe pain and can be quite helpful in the short term. However, many people with chronic pain find these medications ineffective for long-term severe pain and turn to opioids. Opioids such as morphine, oxycodone, and codeine can include many unwanted side effects such as nausea, vomiting, constipation, drowsiness, and balance problems. They are also highly addictive as they activate the brain's reward systems, leading to strong cravings to take more of this medication. In addition, it's easy to develop tolerance towards opioids. Now, what does developing a tolerance actually mean? If you developed a tolerance, then the medication becomes less effective at reducing pain as you continue to use them, and/or you need higher doses to produce the same level of pain relief. Another problem is that if you stop taking or reduce your dose of opioids, you can experience a number of withdrawal effects. Now, what do these look like? Well, cravings, which is a very strong desire to use opioids, restlessness or irritability, depressed mood, poor sleep and insomnia, headaches, joint and muscle pain, muscle cramping and twitching, nausea and vomiting, diarrhea and abdominal cramps, dilated pupils, an increased breathing rate, and elevated blood pressure. For many people, the rewarding nature of opioids, tolerance effects, and withdrawal symptoms can lead you to take higher doses and become addicted to these medications. Also, if you continue with the same dose of opioids, their effectiveness will become less and less over time. For these reasons, while drugs are helpful for acute or short-term pain, many people find that drugs are not the answer to managing chronic pain effectively. If you're worried about the effects of the drugs you may be currently taking, it's really important that you consult your prescribing doctor before changing doses or medications. So if all possible medical options to treat your pain have been exhausted and you're still suffering, then I can offer you a scientifically based non-drug approach to managing your chronic pain that really works. To discover more, visit TameMyPain.com. I sincerely hope, as many of my clients do, that this simple approach to managing pain helps you to live the life you want. Take care of yourself.